If you're having difficulty falling asleep or even staying asleep because you just can't seem to shut your brain off at those times, then you need to keep watching this video. In this video, I'm going to tell you why that is happening, what center in the brain is responsible for that, and what you can do to help that situation. My name is Dr. Anokwute. I am triple board certified in internal medicine, sleep medicine, and obesity medicine. My channel is mainly about sleep issues and what you can do to help with those issues. Insomnia is very common. In fact, I get this complaint from almost every patient that I see in my sleep clinic every day, regardless of what other sleep problems that we're treating. And so I typically get to hear about two main types or subtypes. So some people say, I can't fall asleep. Some people say, I fall asleep easily, but then I wake up in the middle of the night multiple times, and that disrupts my sleep. Now, regardless of which of them, there's something that I've noted that I typically get to hear as a common complaint, and that is that thoughts keep coming to them at that time of the night, and so they can't shut their brain off, and that keeps them awake. So the first thing I want to say is that the main treatment for insomnia is what we call cognitive behavioral therapy for insomnia, and that is CBTI for short. Medications are second line. They have a lot of side effects and are not recommended as first line. The one tool that I will share with you today is part of the CBTI. And so what is that tool? It is called constructive worrying. I know, right? That's someone is like, what does that even mean? Yes, I'm going to explain that. Now, before I go into what constructive worrying is, I want to tell you why it is that you can't just shut your brain off. The center in the brain that is responsible for wakefulness is the same center that is responsible for thoughts, whether it be anxiety-provoking thoughts, whatever kind of thinking there is. And so that center is in the hypothalamus. And so whenever you have thoughts going through your mind, you immediately trigger the wakefulness center. And that is why you won't be able to fall back asleep once you have those thoughts coming to your brain. Now, the question is, why do those thoughts come at nighttime? The reason is obvious, right? We're busy throughout the day, we're at work, we're involved mentally. And so the brain has no chance to take care of those thoughts until at nighttime, when everything is quiet, nothing else is going on in our minds, and all of those thoughts come rushing back at us. Now, what is constructive worrying? Constructive worrying is you setting a time sometime during the day, about 20 to 30 minutes, where you sit down to process all the thoughts that could come back to you at nighttime. And that includes things that are stressing you out, plans that you have for the next day or for the next week. Whatever those thoughts are that keep coming to you at nighttime, that is your time to process them. And so what do I recommend to do at that time? Choose somewhere, maybe after lunch, somewhere around 1 p.m., 2 p.m., where you sit down by yourself alone without any distractions. Get a pen, get a paper, and write down everything that bothers you. If there are plans that you have to make, write down the plans and make arrangements. If there are things that you're worried about, put them down and tell yourself what you need to do about those situations. So basically, this is a time for you to process. And when those thoughts come back to you at nighttime, it's easier for you to tell yourself that you've already processed all these thoughts during the day. But you do have to make sure that you're doing this every day. You schedule it. Of course, that's how to get things done. If you want to get something done, you schedule it, put a reminder on, or put an alarm to say by this time every day, for 20 minutes, I'm sitting down with myself and writing out my thoughts, stressful thoughts, plans, and everything. And so even if it comes back, you can either say to yourself, I already took care of these issues, or I have a scheduled time tomorrow to deal with these issues. And that way your brain easily shuts down, and so the wakefulness center as well gets to shut down, and so you're able to fall back asleep. Keep in mind that if you're having more of sleep maintenance insomnia, which is waking up in the middle of the night, you may want to see if you have other symptoms like snoring, daytime sleepiness, early morning headaches, waking up to use the bathrooms, that could tell you that you may be having obstructive sleep apnea. And so treating that can also help you stay asleep. But some of my patients who have obstructive sleep apnea still wake up once a night, at least sometimes, and they still deal with thoughts coming up. So even if you have sleep apnea, you treated it, you're waking up, that's okay. You probably do have background insomnia. And so this is one thing you can do to fall back asleep quickly.
Now, I do have a few patients that say, I've tried this, it has worked, but there are a few days in a week or in a month where these thoughts are just so stubborn and won't go away. And so what I want you to do, if that has happened to you, is to refocus your thoughts on positive things. Get a pen and a paper and start thinking of things, positive things that has happened in your day or has happened recently. If there are things that you're grateful for, write them down. And you will see that that will calm you down. And so you're able to refocus all of those stressful thoughts and focus more on positive things. So this has also helped. But just the constructive worrying alone has really helped a lot of my patients. But so this is just for the 1% of people that still have 1 or 2 days where those thoughts are still persistent.
All right, I think that's all I have for you today. Please subscribe if you want to hear more things about sleep issues and what you can do about them. Share this video with someone that you think might need it, help a friend. And I want you to know that I'm here. I want to help you live a long, happy, healthy life. And I'm going to leave you today with a quote, and it goes this way. Work all the time you work. Start up a little earlier. Stay up a little later. Work a little harder. Thank you for watching. See you in my next video.